It's almost like a jigsaw puzzle. A normal neck does a normal curve, just like that. Mine was going stacked. One this way, one that way, one this way, one that way, all the way down. So there was really nothing that could be done to restore that curvature except for this major type of surgery. My name is Cathy Delanoy, and I had cervical spinal fusion at Monmouth Medical Center. I was in the gym lifting weights, and as I was lifting them, I noticed that my right arm couldn't lift as high as my left arm. And as I continued to force myself through it, I realized I had a weakness going on. I continued to push through it, and I'd say probably maybe about another 2 or 3 weeks, I noticed it was pins and needles and very, very little pain until the very last, I'd say about a month before my surgery. I knew I had cervical issues, but I started thinking, I wonder if this has to do with one of the discs being pinched. I've had pinched nerves, but this felt like it was almost blocking the blood supply. And that's why I felt weak in the pins and needles. And I said, you know, I think I should at least have a doctor take a look at it.
In her case, I saw a pretty remarkable degree of kind of degenerative wear and tear arthritic changes in her cervical spine and her neck that really had distorted the basic structural integrity of her spine and were causing compression to some degree of her spinal cord.
It was suggested to me that the only alternative I had right now, if I did not want what I was experiencing to become permanent, was to consider surgery. However, it was a very major surgery.
So in her case, we needed to expose the spine from the front and remove 2 vertebrae, 4 discs from 3 to cervical 7, and then reconstruct those areas with basically putting in artificial, what we call fusion cages or struts that are carbon fiber, which actually have a hollow center that we can put some of the patient's own bone inside of as a bone healing substrate, because ultimately you need this all to heal and to fuse. So we put those in spanning from cervical 3 to cervical 6, and then another implant between 6 and 7. And then we support all that with a construct, basically a titanium plate and screws that are secured in the bone.
I feel great as far as my arm. My arm is restored to normal. I don't know that the weakness is completely gone because it had deteriorated for maybe 7 to 8 month period. So that's going to take a while.
She came through things very, very well. She may have a little bit of mild residual weakness of one of the muscle groups in the arm that probably with time will improve, which is further time for healing and therapy, exercise.
He gave me my life back. I had always heard wonderful things about Monmouth Medical Center, and when I was telling people that's where I was going for my surgery, they of course said, you're going to the right place. They are the best. I can't say enough good things about Monmouth Medical. They were great. They were concerned about my pain level. Everybody from the food service people to the phlebotomists to the nurses, the house cleaning. Great. They treated me with so much respect.
RWJBarnabas Health. Let's be healthy together.